skilled birth attendance rate. Skilled birth attendance rate is the next factor in gynecology and obstetrics that we'll be looking at. Now, skilled birth attendance is, of course, you being actually what being able to access, healthcare professionals that were specially trained for this. All right, attending to any labor issues, trying to solve any labor issues. But if we're talking about the rate, it could be that in a particular region, how many of them can we be able to access? Do you understand? So it's now trying to point at the need of training more healthcare providers, okay, with these skills, okay, to actually attend to childbirth. So it just refers to percentage of births attended by what trained health professionals. So yes, women in a particular region actually gave birth, all right, but how many of them actually had access to people like doctors, nurses, or midwives? Do you understand? So this will now help us know, okay, what is the quality of healthcare provided in this particular region? So why it matters is actually a key indicator of the quality of health care that what mothers are receiving and also babies are receiving. So it's strongly linked to what you having lower rate of mothers dying and also lower rate of what babies dying. All right. So it also helps to track progress of what how the World Health Organization is trying to reach out to rural areas and all of that. So how it is calculated? Yes, it's calculated by a formula. So number of skilled births attended by what a healthcare professional over the number of what total births you guys had in that place times 100. Of course, that's percent. Let me say you had about 10 births attended by a skilled professional. All right, then you have about 100 live births. Do you understand? So this was more like 10 all over what 100, all right, times 100. Of course, this will cancel this. All right, so had about just 10%, right, of the births in that place were attended by skilled births. All right, so the data is often collected through household surveys. Okay, so using Nigeria, northern Nigeria as what a case study. All right, so it rose from what 25% to about 33%. This will tell you that okay, the healthcare qualities are kind of like improving, right? So it actually helps you, to know that healthcare services in the place is improving. Factors influencing this attendance rates include education level, age at first marriage, okay, weight status and media exposure, number of antenatal visits. So some people know that the healthcare facilities are not in their region, but they don't really have much importance attached to it. You understand? So they just prefer being with the normal traditional birth attendants in their areas and all of that. So that's just what the skilled birth attendance rate simply is.